have, like the dehydration doc mentioned, you have hypovolemic situations, like maybe you have low blood volume, or that could be as a result of you've lost blood in a way, so the kidneys are not able to, it's hypoperfusion, they are not able to get enough blood, you know, to do the function and the work that it's supposed to do. And then another cause is when the kidney itself is diseased. So you have diseases like glomerular diseases, like nephrotic syndrome. Okay, so in situations like that, the kidney itself is diseased, and the child will have a condition where we call nephrotic syndrome. And so for situations like that, a mother who identifies a child with a condition like nephrotic syndrome, where the child is swollen or has a generalized edema.
So a child
when we
is
talk about generalized edema, we mean the child has swelling or puffiness of the face, the hands are swollen, the feet are swollen, the abdomen is also swollen. So the child has generalized edema. And for such patients, usually the parents would think that it's a case, typically. So when they send the child to the hospital and they are told that it is a kidney disease, sometimes they do not believe it. And they would want to send the child to either the herbal, those who prepare the herbal preparations, or they will send the child to a church, and then later on, when it fails, then they would bring the child back to the hospital. So severally, I have seen situations like that, where parents would send the child to go to those places before they come back to the hospital. There are just a few that would actually stick to the medical treatment from the beginning to the end. And usually, because it takes a while, because before the edema can subside, it will take about 6 weeks. And sometimes they are not patient enough.
We want to see instant results, don't we?
Instant results. So it takes a lot of education, a lot of counseling, a lot of patience to let them understand that it will take a while.
No, but Esther, it's scary. You wake up one morning and your child is swelling all over, from head to toe. Like they say in Chi, like wahohono.
Yes.
You are going to get scared.
Yeah, it's scary. It can be very scary. That is why most of the time when they come, we take our time to, for us as health workers, we don't actually start by concentrating so much. Apart from the medications, we also take time to educate the relatives to understand, or the parents to understand that this is the situation. Okay, so most of the time we start from there. You would have to let the person or the parents understand that this is the situation. Sometimes we go all the way by even drawing how the kidney is, you know, the functions of the kidney. We take time to explain to them.
You want to explain for them to understand
exactly how, and then how long it would take for the process, or for the child to be sort of free from such a condition. Okay, so when you take your time to explain it like that, then they are okay. Then and then there are also cases on the ward. There are also patients who have gone through it, and now they feel better.
Okay.
They see such patients, and then they have some hope that, even though it's scary now, I mean, it will be better.
It will get better.
It will get better.
All right. If you're just tuning in, this is 107.9 Orange FM, and this morning we're talking about kidney diseases, and we're focusing on children. If you never knew that kids can also get kidney disease, well, you have to stick and stay here and listen. That, you know, always when we think about kidney disease, we're thinking adults. No, children also do get kidney disease, and so we're going to learn how to avoid them, how to spot them, and how to make sure that our kids are, you know, living their best life. Dr. AKOI, what are some of the symptoms that parents or caregivers would spot? You know, Esther talked about the the generalized edema and the child is going to look puffy, is there anything else that you would see and say, as for this one, like somebody's asking, the child is always peeing every 1 hour, or she says every 2 hours, my child is always peeing, even though he drinks quite a lot of water. Parents think about those things.
Yes, so in addition to the swelling, there are other signs that when a parent sees in the child should alert the parent that the child may be having an issue with the kidneys and then with the urinary tract. So, for instance, the color of the child's urine. So, we all know what a normal urine color is supposed to be, either clear or what we say straw color. It looks a bit light yellow. So if the parent finds out that the child's urine is looking something like brownish, looking a bit like tea, okay, that would point to a problem with the kidneys. Or the color is looking like Coca-Cola. That's
dark, like the urine is dark.
It's dark.
Very dark.
Very dark, yes.
Okay.
So once a parent sees that, she shouldn't sit at home with the child. She should immediately bring the child to the hospital. Another thing has got to do with the amount of urine the child is making. So if the parent realizes that the amount of urine the child is making has reduced, so for instance, maybe let me use a child who is in diapers. So the mother typically changes the diapers maybe about 4 or 5 times a day, which is what is normal for the child. And then she realizes that maybe in a particular day she's only changed the diaper twice, and the urine in it is not, the diaper is not as soaked as before. That is worrying, which means that the child is not producing adequate urine, meaning that something could be wrong with the kidneys. On the flip side, you could also have the child producing too much urine, excessive urine. So then the mother realizes that the volume of urine the child is producing is way, way more than what the child typically produces. So in the kidneys, we have what we call tubules. They are small, small tubes in the kidney. That does a lot of great work. If there are problems with the tubules, the volume of urine the child is producing can really be excessive and a lot. In such a case, the parents have to bring the child to the hospital so that we can evaluate further to find out what the cause is. Because if the child is urinating so much, the child can actually become dehydrated from that, and that has very bad consequences for the child. And then also, if the parent realizes that the frequency, so what I just talked about was with the volume or the amount of urine, where they realize that the frequency of urination is also a lot. So like the listener who sends a message talking about the fact that every 2 hours the child is going to urinate, every 2 hours, yes. So if they have an infection within the urinary tract, so where the urine passes, either the bladder, which is the storage place for urine before you go and urinate, if they get an infection there, or any of the places from the kidney going down where the urine passes to come out of the body, it can actually, an infection there could cause the child to urinate very frequently, or the child will be experiencing pain when he's urinating. Urinating is not supposed to be painful. But the child begins to experience pain or discomfort during urination, or even sometimes they realize that the smell of the urine has really changed. Yes, these are all things that should alert parents that they need to bring the child to the hospital. And I'll just say one more thing about the swelling, or what we call the edema. So typically the child will wake up and then the face will look swollen, especially around the eyes. They'll look swollen. But then in the course of it, so maybe getting to late morning, afternoon, it kind of disappears. So sometimes when the parents see something like that, they think it's really nothing because the child has just woken up with a swollen face, but by midday it has gone away. So they tend not to take it seriously. But once you notice something like that, it's abnormal. a child is not supposed to wake up from bed with a swollen face. So even if it resolves or it seems to disappear in the course of the day, you still need to bring the child to the hospital for us to be able to evaluate further. Because there are a lot of instances where the parents will notice it, but they don't attach any seriousness to it. Then they only now become very worried when maybe they realize that the child's urine has changed, or maybe the volume has gone down, or maybe it has gone worse and the child is now having seizures, convulsions. That is when they rush the child to the hospital. Or maybe they see blood in the urine. Then that is what tends to scare them a lot, and then they'll bring the child to the hospital. But blood in the urine, yes, immediately send your child to the hospital. But then if you also notice that the child wakes up with a swollen face, which will clear by midday, still send the child to the hospital as soon as possible.
All right. Esther, some of your colleagues are asking me to ask you to hit home that children also need, okay, so let me read. The children also need their blood pressure checked at the OPDs. Kindly ask our senior Esther to explain to us so that some of us who don't do it will understand. So, do we need to check the blood pressure of children at the OPD?
Exactly, we do. We do. We are supposed to.
Okay, I like that one. We are supposed to. Not many people do it.
Yes.
Unless probably it's a renal clinic. But in the general clinics, your colleagues are saying that, well, so one of your colleagues says that she doesn't know how to even check the blood pressure of a child.
She should, because, and for children, there's a skill or a particular technique. It's not like checking blood pressure for adults.
Oh.
For children, you need the right size of cuff. Okay, yes.
Okay.
And then their interpretation of the blood pressure after you have checked it, it's also different based on the child's age, the height, and all that. So it's a special skill. Unlike, and it's not fixed. Unlike adults that you could say probably 110/70 or 120/80 is normal for an adult. For children, it varies. Okay, so we do it in terms of percentile. So we have what we call the 50th percentile, 90th percentile, 95th, and 99.
Okay.
So if you check the blood pressure and it's 50th percentile, then it means it's normal. 90th means it's pre-hypertension. 95th is stage 1 hypertension. 99th is stage 2. And for each stage, you would have to manage it differently. Okay, so if it's stage 1, the treatment and management is different. If it's stage 2, it's also different. So blood pressure check is very important. So I would advise that routinely, it should be checked for children as well.
So then, to all the doctors and nurses and health center heads, physician assistants who are listening, get a pediatric calf swig. You know, they can be a bit difficult to find, but when you find them, most of the shops now have them. They come in these nice, you know, light blue bag with some drawings on them. Just get one, and like Esther is saying, you have to also get a chart, right?
Yes, you get the central chart.
Get the central chart for blood pressure monitoring, and start checking the blood pressures of the children when they come to the OPD. You have no idea what you will pick up. And sometimes that is the only way you can tell that the child has kidney disease, you know, coming up somewhere. All right, if you want to send us a text message, you can send it on 0593 932993, 0593 932993, and I'll read your message for you. So, Dr. AKOI, somebody has come to hospital, maybe their child has very dark urine, which is what I think will scare people to bring their kids to hospital, very dark urine or blood in their urine. When they come for a consult like that, what happens next?
Okay. Yeah, so first and foremost, we quickly look out for any life-threatening or any what we call emergency signs that the child may have. And then we institute prompt management for that. So if the child comes, we check the breathing. The child is struggling to breathe, we may give oxygen. We check the blood pressure. If it is too low, we have ways of treating that. If it's also too high, we have medications that we can give. And then, so once we've been able to identify any life-threatening issues and then put in measures to handle those, we then, the next thing is to try to establish what is causing the urine to look dark. Yes, so then we ask the parents some questions. We do a detailed examination of the child. We take some blood samples to the lab. We take a sample of the urine as well. And then you send that for analysis, just to try to help us to be able to establish what is causing the urine to be dark. And then once we have that, we then institute treatments based on that. One thing about the child having a dark urine is we are so concerned about how it can be damaging to the kidneys. So we put in a lot of measures to protect the kidney from the effects of what is causing the urine to be dark, which in our setting is commonly what we call hemoglobin. So we need to hydrate the child very well. So once we hydrate the child, the fluids that we give the child sort of tends to wash out the hemoglobin, so that the child tends to urinate it out, and it doesn't stay in the kidneys to cause any damage to the kidneys. We also have to monitor what we call the urine output in terms of how much urine the child is producing. If the child is conscious, the child can urinate by himself. We can just provide a container, give instructions to the caregivers and to the child that when the child urinates, don't discard it, keep it, we'll measure it, and it gives us an idea. But if the child is very sick, child is unconscious, then we'll have to do what we call like a catheter, where we pass it through where the urine passes, and then that collects the urine into a bag, and it measures for us. We pay very close attention to the blood pressure of the child. We monitor it several times in a day, because if the kidneys have become affected, what would show that to us will be when the urine volume will be low, the urine output will start going down, the blood pressure of the child will be going up. And then the lab results, what we call the kidney function test. So what we call the urea and then the creatinine would also be going up. Yes, so these are things that we put in measures to monitor for. And then once we see that, then we know that this child has suffered an acute kidney injury from the hemoglobin that was present in the urine. Then in that case, we now put in measures to try to manage that. The good thing about the kidneys is that it's a very resilient organ, such that if it even gets hit by an injury, if we are able to put in measures to manage that, the kidney is able to recover. And then it will be able to now take over its functions. In the very severe cases, we may have to do what we call dialysis. Yes.
For children?
Yes, for children. So we have what we call peritoneal dialysis, which is what we commonly do here for children who come with an acute kidney injury that is very severe. Yes, so for that one, we just put a tube into the abdomen, and then we put in some special fluids, and that sort of takes over the functions of the kidney to give the kidney enough time to recover from the injury. And then once the kidney is able to take over its own functions, in other words, the child now starts making good urine, then we can suspend the dialysis and then allow the kidney to do its work. It's very important, because once the kidneys have failed from, let's say, the dark urine the child was passing, the toxic substances in the body, they stay within the body, because now the urine is not coming. So then where are they going to how is the body going to get rid of all these toxic substances? How is the body going to get rid of all this excess water and all that? That is when the dialysis comes in, and it takes over that function.
So when the kidneys are severely damaged to the point where they cannot filter blood, that's where you do this?
Yes. Yes.
Right.
And then it comes in. So it takes over the functions of the kidney temporarily to allow the kidney enough time to be able to recover from the injury.
Esther and Doc, someone is asking that in the past, it was common for our parents to boil, she says things. There's boiled things. So pineapple, bark, orange peel, lemongrass, to say they do two fever, no? And she's saying that she's doing it now for her kids. And you should see Esther's face. You see Esther's face. Say that she's doing it now for her kids. Esther, is she playing with kidney disease at this point?
I would say so. I would say so because.
But it used to work, or it works.
I don't have the evidence. Okay. So I can only assume, or what I know is that those things like the pineapple,
the neem tree,
no. Okay. Neem tree research has shown that it's nephrotoxic, meaning it's harmful to the kidney. Yes, during COVID.
During COVID, yeah.
We had a case like that in KATH where somebody tried to, she took it herself as an adult and then gave some to the child. And the child came in renal failure.
Wow.
Yes, we had a case like that. So it's not good. Yes, it's not good for the kidneys. It's nephrotoxic, actually.
The way people abuse neem trees, I think during COVID you couldn't find a neem tree. If a neem tree was low enough, you were likely not to find anything on it. Yeah.
Wow. It's nephrotoxic. Science and research
has shown.
Yes, so it's not safe. It's not safe. If the child has fever, like she's saying, I would say that she should send the child to the hospital. There are numerous causes. Okay, a lot of things that can cause a child to have fever. Okay, it's fine to take pineapple. It's fine to take the other, like the orange and the rest. Okay, taking it normally,
not this concoction boiling in a pot kind of thing.
It doesn't help. If you take it normally, the advantages are there. It's better. So I don't really understand why you want to boil it, and it may even lose some of its nutrients if you decide to boil it
that route,
rather than taking it in its natural form. Okay, so I would rather recommend that it's taken in its natural form, and then if there's fever, the child should be sent to the hospital. Yes.
But when you mention fever, she's asking that how much paracetamol is safe for children?
Okay, so routinely, if a child has fever, you could just give a single dose at home, and then you send the child to the hospital. You don't give it continuously, because even though paracetamol is safe for the kidneys, it could also affect the liver if it is abused. So it could be taken 3 times a day in severe situations where the temperature is not really settling. It could be taken 3 times a day to a maximum days of 5. Okay, so a child whose liver function is fine, the kidneys are fine, and due to 1 or 2 reasons, maybe sepsis or other reasons, the temperature is rising. That child could be on paracetamol. Depending on the age, the required dosage is given 3 times a day for up to 5 days. Okay. And that's fine.
That's fine.
That's fine. But to continue beyond that may be a bit problematic.
Yes. And I think it's always good that when you go to the hospital and you end up at the pharmacy and you're giving medication, stick to the dosing. When they say 1 tablespoon and you don't know what a tablespoon is, let them explain to you. Yes, let them explain to you, because these medications are good, but in the wrong proportions they can harm your kidney. There's another question here about what is the required amount of water that children are supposed to drink. Do we have a requirement for kids?
Yes, so we have what we call like a maintenance fluid requirements for children, which we actually calculate using the child's weight.
Okay.
Yes, to be able to determine how much this child is supposed to take. So, for instance, if you have a child who weighs 10 kilograms, he will need about 1 liter of fluids over a 24-hour period.
For the day?
Yes.
Also 1 liter there?
Yes.
Not a lot.
So, I mean, we have ways in which we do the calculations. Yes. So, it will be hard for parents and caregivers to know that maybe this is the amount of water my child is supposed to take based on their weight, and all that, if you are not educated or trained in that field to be able to know that. Yes. But when the child is thirsty, I mean, the body is such that once the amount of water in your body is low and you need water, we have good thirst sensations in the body that can trigger that. So when the child is asking for water, just provide as much as the child will be able to drink. Yes.
And to add to that, children also run around a lot. Sorry, and they exercise also a lot. So in as much as they do that, they take in a lot of water. Okay, and sometimes in addition to the amount of water that is required, for instance, at least 1 liter in the rest, you could also teach your children to observe their urine anytime they urinate into the water closet. Okay, so the color of the urine could also give a hint. Okay, so if the color is a bit darker, or should I say a bit orange in color, it means it's concentrated. Okay, it means the child is not taking in adequate amount of water. So if the child is well hydrated, the color should be very light yellow to clear or to colorless. Okay, so if you are able to teach your child that anytime you pee, just look into the water closet, see the color of the urine. If it's very light yellow or colorless, it means, I mean, you are well hydrated. But if you look at it and it's a bit dark, a bit deep orange, then it means you have to take in more water. Okay, and it's not a lot at once. It's like you take it in sips. Okay, you take it regularly in sips. So that's also an indication, something to let you know that either you are taking less water or you are taking enough water. Thank you.
So to the parents who are sending the questions asking about how much water should my child drink, when they are thirsty, just let them drink water. And it's good that they take it in bits, in sips, than to sit and like in one big gulp. The other popular question that people want to find out when it comes to kidney health is that, and this is children. In adults, we say, restrict salt and all these things. Is it the same for children?
Yes, it's the same. Yes. Kidneys control the blood pressure. So, and the blood pressure essentially is determined by how much water you are retaining in your body, how much water you are retaining in your blood vessels. So if a child has a kidney disease and a child has hypertension, from that, salt is not our friend here. Yes, because once you start taking in the salt, what it does is that it causes your kidneys to absorb so much water back into the blood, and then that will rather worsen the hypertension that you have. So in such situations, we have to restrict the amount of salt that the child is being given. And when we talk about salt restriction, it's not just maybe don't put any salt in the food of the child, but then there are other foods that inherently have a lot of salt in them. So for those ones, you have to really cut down on that. So a lot of the foods that are sold, a lot of the fast foods, and pizzas and shawarma and sausages and the like, inherently they tend to do have a lot of salt in them. So when we talk about salt restriction, we are talking about all these things, cutting these things down. From the diet, some of these chips that tend to have a lot of salt in them, like taking them out of the diet, and not just reducing the amount of salt you use to cook.
Okay,
yes.
so it's the salts can come in the form of all these things that we like. Talking about salt, is it the same with sugar and all these very nice tasting drinks that we give the children to take to school? Should we also be looking in that direction as well?
Yes, it's the same for sugar as well, and for the drinks, what we usually call the drinks. So a lot of sugar in the system also damages the vessels, okay, including the vessels of the kidneys. Okay, so they tend to destroy the kidneys. So whether a child or an adult, you're not supposed to have a high sugar level. Okay, so in order to control the drinks and the bottled drinks that we give to our children to take to school, and it's now like a daily something, we could, you know, do like give maybe an apple.
Yeah, give fruits. Yeah.
Yes, give fruits. If a child is going to school and you give one apple, he goes to school, he takes it. It's better.
Yeah,
it's better than occasionally they can take the drink like once in a while.
Once in a while, it shouldn't be a constant part of their diet.
Exactly.
Okay. So, parents, caregivers, school owners, Sunday school bosses, and madams, I hope you are listening. These are the things that we use to entice the kids to come to Sunday school. We use to entice them to stay within the area that I want them to play, but we may be, harming them, inadvertently. This is the Orange Health Lounge on 107.9 Orange FM, and this morning we're talking about kidney disease in children and why they even matter. My guests are Esther OBENG, she's a renal nurse specialist, and then Dr. KWAME, who is a pediatric nephrology senior resident. We've said a lot, and I want to give you the chance to call in if you have a question on 0541 022 318, 0541 022 318. Esther, so after the child has come in, it's swollen, it's puffy, maybe the child is admitted, do we also do, like Dr. Akwe talked about peritoneal dialysis, but the normal dialysis that we know, do we also do some? Yes, I do also do some for children.
Yes, but we usually do that for older children, okay, because for older children, because at that level their system is a bit mature to handle that nature of dialysis, if I should put it that way. So peritoneal dialysis is a bit gentle. Okay, yes.
It's more gentle.
Yes,
okay.
Yes.
Okay.
So we do that for.
And hopefully cheaper.
Yes. Yes, relatively cheaper.
All right.
It's relatively cheaper because for a child, we use the fluid. It depends on the weight, the amount of fluid you introduce into the peritoneum to help with the hemodialysis. It depends on the weight of the child.
Okay.
So if it's a small child, we just need just a small quantity of fluid, what we call the dialysis, at a point in time.
Just hold on. Let me pick this call. Hello, good morning.
Hello, Doc. Good morning.
Yes, good morning.
Yes, I hope you're doing great.
Yes, I'm fine. How are you?
Good. Also good. I'm Bema calling from Ajeso.
Okay, go ahead, Bema.
Okay. I was being told by a dietitian that when it has an infection and is being treated with antibiotics, it's better to give the child a Greek yogurt because it contains probiotics, and I wanted to know more about it. That's why I'm calling.
Okay, Bema. The team here has heard you. You get a response. Thank you very much for your call. 0541 022 318, 0541 022 318. She's saying that giving probiotics instead of antibiotics. She wants to know if there's any evidence to that.
Well, so in some instances, probiotics can help, especially when we are looking at something like diarrheal illnesses. Yes. But then what is important is that we treat infections with antibiotics.
Okay.
Yes. That is what is most important here, because the infections which are not treated would they have very negative consequences or negative impacts on kidney health. Yes. So I won't advise that parents should use probiotics to treat infections. If their child is showing signs of an infection, child has a fever, has diarrhea, is coughing, any form of infection, it's always advisable to send the child to the hospital so that we can thoroughly evaluate the child, carry out the necessary tests that we can then establish the particular infection we are dealing with, and then give the appropriate antibiotics to that. And I mean, now we are having a lot of issues when it comes to antibiotic resistance.
Yeah.
So the practice of maybe going to the pharmacy to buy an antibiotic for a child because you think the child has an infection, we are not encouraging that anymore. The best is that bring the child to the hospital. Let's test the child and find out which infection we are dealing with. There are so many germs that can cause an infection, and we have tests that are able to let us know it is this particular one, it is this particular one, and then tests that will let us know that, okay, use this antibiotic to treat this one. Yes, because now we are getting very scared. It will get to a point where there will now be resistance to almost every antibiotic we know, and then when it happens that way, what are we going to do next? Yes. So what I would say is that bring the child to the hospital. Let's evaluate. Let's know what is going on. Let's know which appropriate antibiotics to give. Yes.
Yeah. So I mean, it's exactly like Doc said. It's a bacterial infection. Use an antibiotic. Probiotics have their own uses, but they are not medications in themselves. Okay. So 0541 022 0541 02318. Esther, you're explaining the dialysis to us. Yeah.
So I was saying that because we use the amount of dialysis or the fluid we use for the dialysis, for the peritoneal dialysis, may be just a small amount for. So let's say, for instance, 2,000 mils of dialysis, depending on the weight of the child, can be used for half a day. Okay, and that one may make it a bit cheaper. Okay, unlike going through a whole hemodialysis session, which can be very costly.
Very expensive.
Yes, so that's the aspect of in terms of costs. But then we do hemodialysis for older adults who can actually handle the vigorous nature of the hemodialysis. So children also undergo hemodialysis, where the blood goes through a circuit into a machine called the hemodialysis machine, and you have a dialyzer which serves as the artificial kidney. Okay, so the blood goes through and then it's returned back to the patient. Okay, and then we have a couple of patients who are children, older children, that are going through that.
Okay. All right. Let me pick this call. Hello, good morning.
Yeah, hello. Good morning, Dr. GYIMAH.
Hi, good morning.
Dr. GYIMAH, Kobe, name Buakwa.
Yes, Kobe.
Dr. GYIMAH, Nami Islam Pao, Addition, and Modiation. We say, wa Krabi or Ovekasa Johnson. But Johnson, Odenebekwa, Kojina, Obeyin, Nikano. Obejina won't mean Johnson. This a check. So, Timbezemi who say, so do want to mean no man say a kidney problem. And sometimes no yama memoya cry a movie, ye gusuye. You to say, would you so ye deep yellow pa? Oh, yes, fever. You better see her buying on, and then you cry ye gusuye. It is here one say, so a boy kidney na say. Yem fakwa beso and then as mommy was a kidino okuta load bebre ewo your system so a boa or control nyama bebre on into no say activities bay and I be ya my mano ebetima strong na omo bejai activities be no bejai ama be kidney ne be strong amom so omo no si omo ana omo di mo so muni nyame nye adwuma se pa nyame Islam
Kobe that one so as a pan call no out the buy no. So Esther and Dr. Akoi say what Kobe is saying why yes ugusuye in her buying name yaman ugusuye and for some people quite honestly it's very difficult for them to move away from what they are used to. But he mentioned something that when the urine is very deep, automatically we say it's fever. Is that what it's supposed to be?
No. Yes. So when the urine is very deep, like Esther mentioned, it's most of the time it means that the urine is concentrated. So I think I can speak a little tree, right?
Of course.
Okay, all right. And see, Sir Johnson in your yellow pana, I said, say, if you are in Sua, I won't know Issa. And on Ama Johnson in ISA, brought from the Acasset, Johnson, I are concentrated. So what it means is that I'll say, onum in Sua Baby. So that it can bit me Abuama Johnson in I clear and I say any I to say in Sua no. Obisa question be about akola omu Oko Johnson aso mu yini kana ojina hoche ansa na Johnson aba asa ne awo chima ansa Johnson aba we the stress on fa nko hospital if we say especially for boys no your condition be a your friend no posterior urethral valve near chest what it means is that a kwana baby a Johnson no fa no bibi wo hono mo a esi kwan no e yade a yade awa akwala no akwala ne hyehyɛ wo yafunum no e yade bi wo hono mo a ansa na ebe ho akwala ne wo say yere free ho na say it's supposed to disappear but nkwala no bi wo hono mo boys no say ye wo ma sa ade no enko edaso hye ho sa nti abasa na esi Johnson no kwan nti bon say akwala no ba akọ obenya atenka sa Johnson de no nanso so okujina ho so Oko Johnson a obechim sana Johnson no ma ana so ochim ana kakra bi aba ana so ohwana Johnson no so eba sana e was say ode kunko hospital because Johnson ka system ni mu sana etimi damage akwala ni kidneys no ne Johnson twa ne friend no bladder no damage ya no na asan fora kwasura damage kidneys no eno no okwa ye wonhwehwe mu a ye be ya ama no na ye hu se sa posterior urethral valve na me ka ho asem no se ye no a ko ye won operation ayeye ayetimi diji sa de ni free hono mo se na Johnson no betimi nya kwan asen akọ ti we de me stress on fa akola ne nko hospital ni entimi enya nhwehwe mu
that's good. I think say nti akola okujina ho ase or Johnson bechim sa ansa na Johnson aba no ni na no e wo se now kidney disease no looking at it no usually some of these things affect boys more than girls. Is it still the same?
So it depends. Say when we are talking about what we call the congenital defects or congenital anomalies that affect the kidneys and in the urinary tract. So there are some that are peculiar to boys. All because of what we call the anatomy. So the condition I talked about, the posterior urethral valves, is typically found in boys because the structure that forms that, typically in the girls, that structure would eventually develop into the hymen for girls. So they won't have it within where the urine passes. But for boys, that is where it stays. So once it stays over there, it blocks the flow of the urine. Okay, so from the bladder to the urine coming out, that part gets blocked. So that one is typically found in boys. But then there are some other ones that tend to affect the kidneys themselves, which can be found in males or females. Yes, but typically the posterior urethral valve is the one that is typically found in boys.
0541 022 318 0541 022 318. That's the number to call if you've got a question to ask my guest this morning about kidney diseases in children and why it matters. They've really explained why it matters. I mean, to the best minimum, so you understand what is going on. Esther, so when a child is diagnosed with kidney illness, maybe they've done peritoneal dialysis or hemodialysis and all that, and they're eventually discharged, does no, is that all? After that, can the child return to a normal child's life, or do they need to keep coming in and out of hospital?
Thank you. So, if the kidneys recover, earlier on I mentioned that we have the acute phase, which is called the acute kidney injury, and then there's a chronic phase, which is called the chronic kidney disease. So if the child is able to recover from the acute phase and the kidneys are able to regain their ability to function, then that child can go back to school, can go about his or her daily activities. But then for international requirements or standards, that child may have to be coming back to the hospital from time to time for review. So we would have to follow up on that child for the rest of his or her life. So sometimes we could say you should come to the hospital once a year so that we'll see how you are doing. Initially, based on the condition of the child, we could say that come in a month's time, we could increase it to 3 months, 6 months, then gradually to a year. So that is for the acute phase. And for the chronic kidney disease, where the kidneys have virtually lost some huge amount of its function, that one will let the child be coming regularly. The child will have to be coming regularly. It means we are managing the condition. You are sort of reducing the progression of the kidney disease. So when it comes to chronic kidney disease, we have stages 1 to 5. And you would want to delay the progression of the disease to stage 5, which is end stage. At that stage, it becomes a bit difficult for the child. So you let the child be coming regularly. You manage with medications, with diet, with counseling advice, everything. So that is when they come regularly.
Dr. AKOI, someone wants to know, when children are also diagnosed with hypertension, are they also on medication for life? Or it's short term and then they go back to their normal lives?
Yes, so typically for children, hypertension is mainly caused by kidney disease or kidney problems. So it will depend. If the child has, let's say, an acute kidney injury, and then within the period that the child had the kidney injury, the child has hypertension during that, or the child has what we call glomerulonephritis, and the child has hypertension as a result of that. So the hypertension would persist so long as the kidney issue is there. So as we are managing the kidney issues, we put the child on the blood pressure medications, which they take to try to bring the blood pressure down. Yes, but we typically don't let them take it lifelong if it is an acute issue. So what we do is that once the acute things have all resolved, we follow up the child, or we monitor the child. Because if the child has an acute kidney injury, he actually has a lifelong risk of developing hypertension, developing chronic kidney disease later on. Yes, so even if acutely all the issues would have resolved and would have probably taken the child off all the medications the child was on, it's always important for us to follow them up for the rest of their lives, actually. So because we have to be monitoring the blood pressure as the child is growing. We have to be checking their urine for what we call protein in the urine, blood in the urine, which you cannot see with your eyes. We have to do tests on that to know. We need to check all of that from time to time, and it has to be a lifelong thing, because once you get one episode of an acute event affecting your kidney, your risk of having hypertension later on in life or having a chronic kidney disease later on in life is high. So the follow-up has to actually be lifelong. However, if the child has an established chronic kidney disease, for that, our main concern is that we have what we call end-stage kidney disease, which is the final stage in a child who has chronic kidney disease. So what happens is that, like Sister Esther mentioned, that there are 5 stages. So what happens is that if the child has hypertension, the hypertension, if it is not well controlled, would actually speed up the rates which the child will progress to the end stage. Because if the child gets end stage, we now have to put the child on dialysis and then get the child ready for a kidney transplant. Yes, which in our setting here is very, very, very challenging to do.
Really?
Yes. So the main thing is that for such children, they may have to be on the blood pressure medications till we are probably able to get a new kidney for them and do a transplant for them. And then we monitor them subsequently from there. Yes. So for children, it all depends on how much we are able to control what the kidney problem is. That's what typically determines how long they are on treatment for.
So I mean, that's that's very sound but scary advice at the same time. That I mean, if this happens, it's devastating, and kidney transplant is also not. It's not easy to do here, is it? It has to be done elsewhere. Can an adult give their kidney to a child?
Yes.
You can?
Yes. Usually it's an adult kidney that's given to a child. So a mother or a father can give or donate their kidney to a child. Yes. So a lot of tests will have to be done to check whether it's compatible. We call it matching, to check whether it's either the father's own that matches or the mother's own. Yes. So a child can actually take on an adult.
But I mean, either way, it's difficult to picture.
It is, and it's quite expensive actually. Currently, it's very expensive. A couple of transplants have been done here in Ghana for adults.
Yes, I think I've seen that.
Yes, so for children, hopefully, we are yet to
get there.
But a couple of them have also gone outside the country to have it done. They are back and they are looking very well.
Yes. But generally, how are kidney nephrology related services? I know for the adults, I mean, it's not really great. But for kids, it's the same picture. Is it the same? I've forgotten the word. Is it B4? Yes.
Yeah.
Is it still B4?
Yes, still B4. That's our nephrology ward.
Still the same number of beds on B4?
Yes.
Wow.
It will get better. But we are managing with what we have.
No, we need people. Listen, if you're listening and you want to do something good, it's Ramadan. You know, the fasting has ended. People are chilling. For those who are doing Lent, it ends next week. Listen, if you want to do some good, go to Confanoche, go to B4. You just, as soon as you enter the ward, you'll be touched to do something. If it's still the B4 that I remember in my head, then it's still the same. Just go there and do something nice for the ward, at least for one child. Sometimes the bills that they have are really high. All right. AK is saying that the challenge for children when it comes to kidney illness is that you may not think it is their kidneys until it gets to the very, very end of the disease. That is when somebody may tell you that it's the kidney disease. She's saying that she had a child who used to come in consistently with flank pain and back pain, and they kept giving pain medications and doing all sorts of things until later they realized that it was an acute kidney injury, which they had not paid attention to for so long.
Yeah, so now that's why we're sort of creating awareness about it, so that everybody would sort of routinely also test. Okay, even if you do a urine dipstick, just a urine dipstick will tell you a lot, okay, about whether the kidneys are okay or not. And then for healthy individuals per se that we see, we always say that do one's routine check every year. So on your birthday, you could decide to go and check. Okay, so for your child, you can do same. Okay, you can let them do a simple urine dipstick. If everything is fine, that's fine. If there's a problem, they will let you go further to do a renal function test to check if everything is fine. Okay, then that the hospitals to encourage our fellow health workers to also do routine lab investigations, or even a dipstick that will actually, sometimes even kidney disease can present as malaria. Okay, the signs and symptoms. So people treat again and again and again, and it's not. You should give you a clue that why don't I check the kidneys as well? How are they doing? Okay, and again, a urine dipstick can tell you a lot.
A urine dipstick is an inexpensive tool
very, very
that
cheap.
can be used. I think initially, I don't know, we tried to make it very routine at the OPD, especially for malaria cases, to be doing routine dipsticks. Somewhere along the line, I think that we stopped. But I think there's something that we need to start. I mean, a dipstick is like what, 20 pesos or 40 pesos. Just buy it and just do it and learn how to read it properly within the right time. Yeah. Yes, and I think that it will go a long way to help us. 0541 022 3188 is the number to call. And you know, if you step outside and look outside right now, you can tell that the sun is not coming up anytime soon. So all the laundry you have planned to do for Saturday, let me tell you how to sort it out. Kumasi has the fastest, cleanest, and the most convenient laundry service in town now, and it's called Spain City Laundromat. At Spain City, they wash, dry, and fold your clothes in under 2 hours. They offer this service for homes, for hotels, and restaurants. Spain City has brand new machines that gives your clothes a very nice, sparkling, and clean finish. And when they are done, they'll pack them in their Spain City bags. At Spain City, it is one customer, one machine all the time. They will not mix your clothes. And from now, which is today, from today till 31st December, I mean, that's a long time, enjoy their free after 9 promo. Now, what this means is that you wash your clothes there 9 times and you get the 10th wash absolutely free. They are open every day from 8 a.m. to 8 p.m. They have branches in Accra and Kumasi. In Accra, find them at Asheleboche Lakeside, in Dansomande at Akoko Photo. And then they're also at UPSA in the Prestige Building. In Teshi, find them at Teshi Tebibiano. In Kaneshi, they are at Kaneshi behind the Kaneshi Police Station. Here in Kumasi, they are at the Kumasi City Mall at the same entrance as the ShopRite building. You can call them on 055 445 5314. And then at Aijasi, they are adjacent Check City, where you can also call them on 059 577 7371. You can call them now and let them handle that laundry. Spain City Laundromat, wash, dry, and fold in 2 hours or less. And this is the Orange Health Lounge, and we're talking kidney disease. Today we're wrapping up a bit early. We'll wrap up at 9:30, and we only have 10 minutes more on the show to go. So if you have a call for us, call us on 0541 022318, 0541 022318. That is the number to reach us on here on the show. So we've been talking about kidney disease in children and anything else in between that's happening. If you are not sure, you don't know your child's kidney status, like Esther said, when it's their birthday, take them in for a comprehensive kidney screen as part of their health screen, and start filing those and knowing where your children stand in terms of kidneys. Dr. AKOI, when we talked about the salt reduction in diet, someone is asking, is it complete salt removal from the diet of the kids, or is there a recommended amount of salt that we must give our children? So I'm asking because a lot of their food contains a lot of salt.
Yeah, so I initially mentioned some foods that inherently have salt in them, like the chips and the junk food and all that, yes. So if it's possible to eliminate that from the diet of the child, then that would be preferable. When it comes to meals that are cooked at home, if the food doesn't contain any salt at all, then that will be very difficult for the child to eat. Because remember that children are growing, they need nutrients, they need calories and all that in order to enable them to grow. So just a reduced amount, which can make the food a bit tasty for the child to be able to eat. But then not putting so much
don't pour all the salt in the food.
In the food. So just a little that can bring out the flavor in the food to enable the child to eat. Because even as we are advocating for reducing this, so we also need to bear in mind that children are growing, they need their nutrients, they need the calories in order to be able to grow. So if you make the food such that it's completely tasteless, then the child is also not going to eat, and that is going to affect. And then the child may actually go out and rather be buying the ones that have so much salt in them. So it's all about moderation.
And don't sprinkle extra salt on their fries.
And you could also use the recommended amount. Actually, is half a teaspoon. Okay. So if you train the children, you see from the beginning, when you cook like that, as they grow, their system gets sort of used to it. So even when they go out there, they taste something that is a bit more than what you serve at home, they may even reject it. They say that, this is too salty.
This is too salty for us.
So let them grow with that level of, normal or adequate amount of salt, not too much salt. Okay. But when you start them on very high salt, or the food is so salty, and then later on you come back and you reduce, that's where, so in as much as we're trying to prevent it now, it's good for all of us, not only children. Okay, so for all of us, the whole household, everybody should take in less amount of salt. So when you are cooking, just add about half a teaspoon. Okay, thank you.
All right, guys, we're wrapping up at 9:30. Any final words before we move out of the studio? Dr. AKOI, let me start with you.
Yes, so for this year, we are focusing on the environment. Yes, so the environment is closely linked to kidney health, whether for children or for adults. Yes, so this is a passionate appeal that we are making. So sanitation, proper waste disposal, and then the issue about illegal mining activities, because they tend to pollute the water bodies with heavy metals, with chemicals, which then go into the soil, the crops that are grown in those areas and all that. And these heavy metals are very toxic to the kidneys. Yes, so this is an appeal. I know government is putting in some efforts to crack down on illegal mining activities, but we need to really intensify these efforts, and then issues with sanitation, proper waste disposal, reducing diarrheal illnesses, reducing malaria. These are things that we can do, that we have control over, that we can do in order to be able to help protect our kidneys, for us to be able to live longer here. And then also areas where they don't have access to safe drinking water. That is a real problem, because a lot of diarrheal illnesses tend to be waterborne when you are drinking in contaminated water. All that. So this is something that government probably needs to take a look at. There are some communities in the country that still drink from rivers and still drink from streams, and putting them at risk for a whole lot of illnesses and diseases. Yes, so, and then plant a tree. Wherever you find yourself, is very, very important. Not only does it help to cool the environment, because now the weather is really very hot, and you get dehydrated, especially for children. You get dehydrated easily if you don't take in enough water. Dehydration is one of the things that's very risky to the kidneys. So plant a tree wherever you find yourself. Yes, not only will it reduce the amount of carbon dioxide in the air, which will protect the ozone layer, but it also helps to cool the environment.
So plant a tree.
Thank you
very much, Esther.
Thank you. So I would say that as for taking in adequate amount of water, we would have to be saying it over and over again. Okay, so let your children take in a lot of water when they go to schools. I mean, I would even wish some of our teachers will even have water break. Okay, so if you have 2 hours of teaching, and you could even in between say that it's time for everybody to take in water. And then maybe after 30 minutes, you give them some 5 minutes break to also go and pee. Because sometimes the fear is that if they take in so much water, everybody will be going out to go and pee. But there should be a break for that as well. It will really go a long way to help. So let's all take in water. It's so cheap, it's so easy to get and to drink. So let's keep on hydrating. And then when it comes to the drinks, okay, we mentioned earlier on that you can rather substitute with fruits. Okay, so an apple would do, a banana would do, okay. So when they are going to school, you can give them some banana, add some granules to it. You can, alternate it. Every other day, you give them something different. Okay, today is apple, tomorrow is banana, the next day is watermelon, something like that, and they will really grow to become healthy. And our school authorities must also, in their canteens, sell some of these things, okay. Aside the drinks, also make it available for the children. They'll buy the fruits. So our schools should also make them available. And then routine checkups, okay. So it's very important from the ages of, from 3 years onwards, every year you could let your child go to the hospital, have a thorough checkup, or even check their kidneys, okay. A simple urine dipstick would do. Thank you very much.
All right. And that brings us to the end of today's show. They were closing slightly earlier to make room for something else. And I hope you've enjoyed the conversation. I hope you've learned something. And I hope you change certain things about yourselves and you and your children so that you can enjoy the best that life has to offer. If I haven't learned things as I've learned, I'm going to plant a tree today. So I plant a lot of flowers, but I think I'll plant a tree today. Thank you very much. Thank you to my guests, Esther and Dr. AKOI, for joining us on the show to talk about kidney health and why it matters in children. My name is Dr. GYIMAH, show produced by Alyssa Davina. And we're back on your radio next week. I think next week is Easter, isn't it? So we're going to take a break on the Easter, and we'll come back after the Easter to do another show. We're back. Thank you very much.